nutritional and food requirements of expected mothers. So there are a lot of physiological changes that takes place during pregnancy. Okay, a woman's body undergoes tremendous amount of changes when it comes to pregnancy. Okay, anatomically, physiologically, a lot many changes, and whatever her nutrition is during this particular time period, whatever her nutritional requirements are this particular time period, it has to be given specific your consent should be there, because any nutritional deficiencies would not just affect the impact the health of the mother, but also the growing fetus within her. Okay, for example, if you say vitamin B12 or vitamin B deficiencies, B complex deficiencies that takes place in pregnant women, that would lead to cerebrospinal inefficiencies and any congenital inefficiencies specifically that affects the brain health, the spinal cord development of the child can take place, and it is irreversible damage. Okay, the child may be born with anencephaly, absence of skull. Okay, absence of the skull cap. The child will be born with spina bifida. Okay, cleft lip, cleft palate. These kids are born to mothers who are vitamin B and folic acid deficiencies. Okay, so based on the various system, these are the different cardiological and cardiovascular and respiratory, gastric, and general changes that happens in a pregnant woman when the blood chemistry. So you can see here, blood chemistry, it means your blood cells, blood plasma level, the volume of the blood, the amount of blood, the blood cells. Okay, how it changes in pregnancy. There is an increased number of blood cells, specifically WBC and RBCs will increase. Okay, the growing fetus, the growing uterus requires more oxygen supply. Along with that, immunity. Okay, the pregnant woman's immunity has to be boosted up. Increased clotting factors, increased fibrinolytic activity. Fibrinolytic activity, these are associated with blood clotting. You get hurt, blood comes out, it clots, right? It will not keep on oozing out. Okay, that's because of coagulation, blood coagulation. So fibrolytic activity and all, it is related to the blood coagulation process. Okay, in depth you don't have to go about it, but these are the areas that get increased as a part of the physiological change in pregnancy. Iron deficiency and anemia are very common in pregnancy. It is very common. That's the reason why we have to provide them with folic acid and folate tablets. Ferrous sulfate and folic acid tablets has to be provided with. Then coming to the cardiovascular system, tachycardia. Tachycardia means increased heartbeat. Heart rate increases. Reason being the blood volume increases. Okay. If at the start of your pregnancy, if a mother was having, let's say, around 1,500 ml of blood, okay, 1.5 liter of blood was present in her system, by the end of the pregnancy, last 9th month or 10th month, she will be having 2.5 liters of blood, doubled, or almost the amount of blood may have doubled. Okay, so that will definitely have some effect on the cardiovascular system. Okay, the amount of blood when she started the pregnancy and what she has at the end of the pregnancy, you can see the amount of the volume of blood is doubling. So definitely it will have the impact on cardiovascular system as well. Okay, so tachycardia, when the blood volume increases, okay, the heart size is same, vessel sizes are same. Okay, but it has to pump a lot of volume, many volume of blood has to be pumped out in the same one go. So that's the reason why heart rate increases. Increased cardiac output, heart rate, increased stroke volume, that is the blood volume increases. Okay, coming to the respiratory system, displacement of diaphragm superiorly. When the uterus is growing, it is growing up. Diaphragm is a muscular, it's a muscle that separates your thoracic cavity, that is the chest cavity, from your abdominal cavity. Diaphragm is that muscle sheath. Okay, and when the uterus is growing, it is growing upwards, pushing all the abdominal organs up into the diaphragm. And diaphragm is what it prevents the abdominal organs into getting into the thoracic cavity. Okay, so diaphragm is moving upwards. It is pushing your lungs. Earlier, how much of space lungs had to expand and relax while breathing. Now the lungs are also squished upwards. Okay, very little space the lungs will also have to expand and breathe consciously. So displacement of the diaphragm superiorly. So superiorly means diaphragm is moving upward. Okay, so squishing all the lungs also upward. So definitely respiratory distress will be there. The mothers by the end of the pregnancy, specifically during the last 2 months of pregnancy, will face that displacement, specifically while she's lying down. Okay, if she's lying straight, she will not be able to breathe properly. She has to lie on the sideways, or she has to have some support of 45-degree or 35-degree angle support. At that elevation, she may have to sleep. Okay, so that is because of the displacement of diaphragm. Decreased functional reserve capacity. The lungs oxygen reserve capacity is decreased, so that's why breathlessness will be there. By the end of the pregnancy, the rate of breaths per minute increases. Increased risk of apnea and dyspnea, hyperventilation. Apnea is breathlessness. Okay, dyspnea is difficulty in breathing. Hyperventilation is breathing very frequently. The number of breaths have increased, and she's opening her mouth and also breathing. She's not just breathing with the nostrils, but she is taking breaths through her mouth as well. That is hyperventilation. And then gastrointestinal system, nausea, vomiting, heartburn, acidity. Okay, when she's on, if the mother is on folate and ferrous sulfate tablets, iron tablets, constipation will also be there. Okay, and certain food intolerances may develop that could lead to diarrhea. Okay, nausea, vomiting. Specific food intolerances develop only during pregnancy. That could also have an impact on food changes as well. Then general changes, behavioral change, mood and behavior. Okay, it is unpredictable because of the upsurge of hormonal activity. Okay, increased nutritional demands. Okay, the increased nutritional demands, it does not mean, it's a myth that people say a pregnant woman from day one onwards she has to eat for 2. It's not like that. Okay, we will discuss exactly how much caloric increase you have to give in which trimester, how much calorie increase you have to give. We will discuss that in detail. Okay, so these are the basic major physiological changes that takes place in pregnancy pertaining to your requirement for this particular course. This is what you have to understand. Is it clear to all? Is it clear to all? Next is the role of placenta. So, placenta is the vital link that is between the mother and the child. Whatever the mother eats, the nutritional part of it, if the child has to get, it goes through the placenta. The mother breathes in oxygen, and the child releases the carbon dioxide. This exchange also takes place in the placenta. Okay, even the medications, certain medications can also pass through placenta and it can reach the fetus. Okay, mother's behavior, mother's stress levels, okay, immunity, even the immunoglobulins, they also pass through the placenta and reach the child and protect the child. So that is the placenta is a very vital growing part during the pregnancy. The placement of the placenta is also very critical. Okay, certain in here you can see it's a normal placement. You can see here the placenta is placed superiorly. Okay, this is a healthy pregnancy, but in certain cases the placenta is placed near the cervix. Okay, or somewhere near the very near to the cervix. So if this woman goes for normal labor or vaginal delivery, it is a high risk pregnancy. Okay, it can lead to hemorrhages. Placenta can rupture when the child is trying to get because of uterine contractions. When the child is coming out of the vaginal canal, the placenta may rupture. It can be a fatal condition for the mother. Maternal mortality rate, it could lead to maternal mortality as well. Okay, so that is the placement of the placenta is also very important. Okay, so placenta the main aspect which you have to remember here is uh, the uh, the health of the mother, okay, and the kind of behavior, the eating behavior or whatever addictive behavior the mother may have during pregnancy. It does not affect her on body. Okay, for example, if a pregnant woman, she has any drug abuse issues, smoking issues, okay, alcoholism issues, okay, whatever she's putting inside her body is not only affecting her, she herself is the first generation, she herself is her own generation. So mother is the first generation, her second generation is the children she is going to bear. Okay, so that affects the fetus also, her behavior, her negative behaviors, negative substance abuse behaviors will definitely affect the health of the child as well. But not just that, every fetus, may it be male or female, when the fetus is developing, within the developing fetus, the future generation, the reproductive cells of the third generation is also developing. Okay, so these kind of abusive behaviors, substance abuses, smoking, any intoxication issues, addictions, that not only affect the first generation, the second generation, but it can also impact the third generation as well. That is, the growing fetus's future generation can also be impacted. Okay, so that's the importance of placenta. Okay, if the placenta serves as this vital link between the first generation and the other two generation as well. Okay, and women who are undernourished, malnourished or undernourished, their placental size will be quite less. Okay, their placenta will not be of the normal size, which means that if the placenta does not have enough surface area for the exchange of nutrients, exchange of gases, definitely a woman who is undernourished with small sized placenta, she will also give birth to a low birth weight baby, small for gestational baby, because placenta did not had proper surface area for the adequate absorption and exchange of nutrients, gases, and all the other excretion of the child. Okay, so that is the importance of placenta here. Then we have the preconceptual nutrition. It means when you are in the family planning state. Okay, when a woman is in her family planning stage, she decides that she wants to become a mother soon, but before she gets pregnant, there are certain areas in her health that she has to correct, so that she can achieve healthy, she can maintain her pet fertility, she can achieve pregnancy, she can conceive without any artificial or hormones, or without any other fertility treatments. Okay, so these are the certain minerals, vitamins, and other nutritional components which is known to boost the fertility in women. Okay, first is your iron. Okay, before getting pregnant, if the woman is planning for family expansion of family, she has to make sure that her deficiencies in these areas are completely cleared. Okay, so the chances of conceiving becomes higher. So iron deficiency has to be corrected. Any magnesium deficiency, which is rare, magnesium deficiency is not common, but magnesium nutrient should be enough and abundantly present in her diet. Folic acid, essential fatty acids, omega-3, omega-6, omega-9, calcium. Okay, these all nutritional components deficiencies should be completely avoided, or it has to be corrected, and then you can go for conceiving. So mothers who weight less than 40 kg are used as a cutoff to predict low birth weight babies. LBW means low birth weight babies, or SGA means small for gestational age. Small for gestational age. These are gynecological terminologies. Okay, low birth weight babies means the child was born adequately after 9 months plus 2 or 3 weeks. Okay, approximately at 42 weeks the child was born. Okay, but the weight of the child is less than 2 kg. Okay, we even in low birth weight we have different classifications. Some extremely low birth weight, very low birth weight, low birth weight. Okay, less than 2 kg, less than 1.5 kg, less than 1 kg, less than 500 grams. Okay, there are different classifications for low birth weight babies as well. Okay, Small for gestational age, again, gestational age was correct. Maybe it was seventh month or 8th month or 9th month, in whichever month the child is born. But the size of the child, the growth of the child is not caught up adequately. That is small for gestational age. Okay, low birth weight babies may the regular low birth weight baby may look quite healthy, but if you go and check their weight, they will weigh below 2 kilograms. Okay, in India we consider the child who's less than 2 kilograms is considered as a low birth weight baby. Okay, small for gestational age, they haven't achieved adequate amount of growth in terms of length and weight. Okay, in babies, in infants, we see the length, not the height. Okay, length of the child and the weight of the child is not adequate enough for the gestational age. That is small for gestational age babies. So mothers, during their preconceptional time, they have not become pregnant yet. Okay, but any woman who weighs around 40 kg or she's weighing less than 40 kg, there are high chances that she may give birth to a low birth weight baby or a small for gestational age babies. Okay. So a woman whose diet is adequate before pregnancy usually is able to undergo the full term of viable pregnancy without much complications. Okay, a well-nourished mother there are high chances that her childbearing months will be filled with less complications. Okay, but it is the opposite for mothers who may be overweight and also who are undernourished. In both the extremes, pregnancy could get tricky. So there is a small table kind of situation given in the textbook. So these are the laboratory reports that during pregnancy one has to check the major prenatal nutritional alteration before during the pregnancy. What all nutritional requirements, is it adequate or not? How do you analyze from the blood test? It is given the homological status, white blood cell, serum albumin, okay, serum vitamin C levels, serum folic acid, B12 levels, serum carotene levels, vitamin A levels. Okay, so these all levels have to be checked when she is pregnant. Next, coming to the nutritional requirements during pregnancy. Energy is increased, especially during the second and the third trimester. Energy is drastically increased. In first trimester, there is no substantial change you have to do in your diet, except for adding few nutritional supplements like iron and folic acid. Apart from that, you can continue your regular balanced diet. Okay, in the first trimester, mothers usually face a lot of morning sickness as well. So the symptomatic management measures have to be taken during the first trimester. But energy increase, to increase a little bit of food, to have more extra food for the growing fetus. This concern should come only during the second and third trimester, specifically on the third trimester. Okay, so eating for two, these kind of myth will not usually work. It will usually lead to further complications in pregnancy because of heavy weight gain in mothers. Okay. So energy is required for the growth and activity of the fetus. Fetus is also moving inside the amniotic sac. Okay. Inside in the womb, the fetus is also moving. So energy is required for the fetus movement and activity as well. Growth of the placenta. Placenta is also will keep on growing along with the fetus. Okay. Outside the amniotic sac. Maternal tissue, normal increase in the maternal body size. For that also energy is required. Pregnant women have to put on weight. Okay, deposition of fat, because this fat deposition will be used when she is lactating. Okay, after pregnancy, when the mother is lactating, this fat deposition will be used. Additional work involved in carrying the weight of the fetus and extra maternal tissues has to become, because specifically by the third semester, mothers require more energy because she is carrying this weight around with her. Okay, 24/7, this new weight is on her to carry that weight. Okay, to do her day-to-day activities with this additional weight, energy is required. So energy increase is important. You cannot continue your entire pregnancy with the same calories what you started your pregnancy with. So protein requirement. So yeah, in the textbook they have given at what trimester what kind of energy requirement you should be looking forward for. In first trimester, hardly 85 kilocalories or 70 kilocalories increase can be taken. It means you can have one chapati extra, a bit of rice extra. That will take care of this first trimester. Second trimester, you are looking at around 280 to 230 kilocalories increase. So adding few more, if you do not want to increase the bulk of your diet, okay, in the second trimester, women can add more ghee into their food. After the food has been prepared, just add a teaspoon of ghee into the food. You can definitely increase bit of your fat consumption, because this excess fat, even if it is deposited on the body, it will be used up during lactation. Okay, so if you do not want to increase the bulk of the diet, because having a heavy diet, if you increase the bulk of the diet, the content of the diet, it can aggravate your breathlessness. Okay, specifically during the third trimester, women usually suffer from a lot of breathlessness issues. On top of that, if you are increasing the bulk of the diet, it will aggravate the situation. Okay, having a full stomach diet, and on top of that, breathlessness is there. It will not be a relaxing situation for the mothers. Okay, so the best thing you can do is you can just increase the fat content of your food. It will automatically increase the calories as well. So protein, average woman, sedentary working average woman should definitely have 55 grams of protein on a daily basis. But if she gets pregnant, 55 is the baseline protein requirement for all the women. This much protein requirement should come from your day-to-day diet. But when she's pregnant, she's expected, add more 23 gram to that. Okay, so 55 plus 23. It will be around 78 gram, or just target it as 80 gram. 80 gram of protein per day she has to take. Okay. Visible fat, 30 gram of visible fat is completely fine on a daily basis for women. Usually for women, sedentary level women, they have to constrain their fat consumption to 20 to 25, not more than 25. But during pregnancy, up to 30 gram of visible fat. Visible fat means the oil, the ghee, butter, which you use, okay, which you go buy from the market and you use in cooking, refined oil, virgin oil, okay, the ghee, butter, okay, these all are called as visible fat. Okay, so 30 gram of visible fat can be used for the entire day. And along with that, add more 200 mg of DHA per day. What is DHA? Under what classification does DHA come? The previous batch students who are attending the class, they can answer. DHA is a type of omega-3 fatty acid, essential fatty acid. Okay, this is visible fat. 30 gram is of visible fat. The remaining 200 mg additional, we have to focus on omega-3 fatty acid. Okay, DHA being a main constituent of omega-3 fatty acid. Okay, just follow, for practical purpose, just follow the table that is given in the textbook. I have the old edition. When I'll get the new edition, we can make the changes. Okay, just follow what is given in the old in the present textbook, whatever you have on your hand. So calcium intake around 1200 mg per day. I guess we have done an assignment on pregnant women. Am I correct? Have I given assignment on menu plan or a diet plan for a pregnant woman? Those who have done the assignment, they can mention in the chat box. Or is it for the previous batch? Anyone from the previous batch who's still attending? I guess I remember giving it for I guess a week's menu plan or a day's menu plan. Something like that for pregnant women, we have given assignment. Yeah, we have. Anuradha Verma says yes, so she may have done that. We'll check that, okay? So calcium, 1200 mg per day has to be maintained. So yeah, for the previous batch, I must have given, and some students who are attending from the previous batch, they must have done it. Iron content, 35 mg per day, including the iron supplements, okay? The reason why this increase is given is mentioned in detail in the textbook. You can read through it. So adult women, in a normal adult woman, the iron content is around 25 mg per day. And out of that 25 mg, just 3 to 4% of iron will be actually absorbed in the body. Okay. When you are having this 35 mg of iron, this entire 35 mg of iron is not getting absorbed. Okay, hardly 5 mg or maximum 10 mg of iron can get absorbed in the pregnant woman's body. The remaining is just flushed out of your body through feces. Okay. And why we have to increase the iron intake? Because the newborn, the infants, the fetus is also generating the RBCs, the hemoglobin level has to be maintained for the growing fetus as well. And the growing fetus's liver also should have iron stores because the breast milk does not have iron. Okay, so iron has to be given specific importance because iron will travel to the placenta. It will go into the fetus's blood circulation. It will get deposited in the liver. Okay, and this iron deposition is going to support the health of the child for the next 6 months after the child is born. Okay, because the mother's breast milk will not have iron, so the iron deposited in the liver will be used up for the infant's growth and development. Okay. Sodium, there is no need to take extra sodium. There is no need to take extra sodium in pregnancy. But if you are diagnosed with gestational hypertension, you have to limit the sodium consumption. Okay. Yeah, in new textbooks, slightly different values may be there. What I have right now is the old textbook. Okay. You just follow the textbook which you have in with you. Just follow that particular book for your practice. Okay. For pregnant women, sorry, the adult woman, 21 mg is for adult women. Pregnant women, the iron requirement is 35 mg. In the old textbook, it is 35 mg. I do not know what they have mentioned in the new textbook. Just check with the ICMR table, which is given in the front of the textbook of dietetics. You can find some answer there as well. But in the old textbook, this is what we have. Normal adult woman will have 21 mg of iron per day. And in pregnancy, 35 mg of iron per day has to be followed. Okay. So this current presentation is based on the old textbook, the old edition. If you have the new edition, just focus on what textbook you have with you. Just focus on that and do a comparative study of the ICMR table which you have got. Every textbook has an ICMR table. Okay. Please check the ICMR table. If in the chapter you have confusing values, please check the ICMR table. In every textbook, ICMR table is given. Please check with that. In ICMR table, the entire vitamin mineral components in different physiological stages of the woman's life, like lactation and pregnancy, and regular adult woman is also mentioned. Teenage. Iodine consumption 100 to 200 microgram plus 25 microgram. Again, in iodine, additional care for adding more salt or something to get iodine is not necessary. When you increase certain fruits and vegetables, okay, when you increase the amount of fruits and vegetables in your diet, automatically this component will be covered up. Okay. Zinc 12 mg to avoid any deficiency. Okay. Again, you don't have to focus on the zinc values which are present in your present diet. You just have to focus that you do not have zinc deficiency. When you get your blood analysis done, when blood reports are regularly taken, okay, when a woman is pregnant, blood reports are taken to find out if she's suffering from any micro deficiencies or not. Okay. So only if she has zinc deficiency, she may be provided with some zinc tablets. Otherwise, if she is not deficient, so she just have to continue with her regular diet. Okay, just to avoid deficiency, zinc, or just to correct deficiency, zinc supplements will be given. Otherwise, there is no reason to worry about the zinc in your diet. Vitamin A, 6,400 microgram increase should be there. You can only do it by achieving more or eating more yellow and orange vegetables and fruits in your diet. Okay. Or adding more, if you are a non-vegetarian, adding more liver organ-based diet, organ meats like liver, etc. If you add more into your food, you will get more vitamin A. Okay. For vegetarians, add more yellow and orange fruits and vegetables in your diet. Okay. You can get enough amount of vitamin A. So vitamin D, highly essential because it enhances the mother's calcium absorption. Okay, mother is having calcium, 1,200 mg calcium per day she has to take, but only in the presence of vitamin D, in appropriate amount of like if she's deficient in vitamin D, calcium absorption will also be reduced. Okay, to maintain that proper calcium absorption, vitamin D values has to be maintained. And this vitamin D in form of calcidiol and calcitriol can cross your placenta easily, and it can also play an important role in the metabolism, calcium metabolism in the fetus as well. Not just for the mother's health, but the growing fetal health also, vitamin D is highly essential. And if the mother is deficient in vitamin D, it can lead to neonatal hypocalcemia, less amount of calcium in the fetus's blood. Okay, in the fetus's blood, calcium levels are quite low because of the mother's vitamin D deficiency. And having too much is also will lead to other complications. Vitamin A, all the polyunsaturated fatty acid. PUFA stands for polyunsaturated fatty acids. Okay. For example, all your vegetable oils, seed oils, nut oils, they all come under polyunsaturated fatty acids. Okay. Mustard seed oils, all your vegetable oils, okay, groundnut, peanut oil, all these things will come under the polyunsaturated fatty acids. So vitamin E, the good source of vitamin E is just add more polyunsaturated fatty acids in your diet. Okay. Butter, ghee, they don't come under this particular category. And if mother is deficient in vitamin E, it could lead to stillbirth, abortions, miscarriages. Vitamin E deficiency has an association with spontaneous abortions, spontaneous miscarriages. Okay, stillbirth, and the child is born without life, the child is born dead. Okay. Water soluble vitamins, just focus on table 8.1. Just focus on table 8.1, those who have the textbook. Based on the ICMR data, you can put the page number in the chat box as well, because my textbook page number will be completely different from what others are having. (146). So just check all the water soluble vitamins, that is your vitamin B complexes, the list of vitamin B complexes, vitamin C. Okay, it is mentioned. What is the requirement of a normal adult woman and the pregnant woman, lactating woman? These tables you can just check. No need to mug up any values. I repeat that. No need to mug up any values. Okay. Just for your knowledge, whenever you require an additional help to understand what is the requirement of these water soluble vitamins in a pregnant woman, you can just open this page number even when you're practicing after the course. When you're practicing, since you can come back to this page number. That's it. No need to mug up any values here. Vitamin C, what is the regular requirement in a adult woman? Along with that, she has to add more 40 mg of vitamin C. That is plus 40 mg, which we have mentioned. Whatever vitamin C is required. What is the amount of vitamin C requirement mentioned here in the table 8.1? Can anyone just put in the chat box? (65 for adult women. Plus 15 for, so again, the ICMR has changed this value as well for vitamin C. So this is the reason why when it comes to RDA, don't depend on the textbooks. Okay. Don't depend on the textbooks. You can directly go and check the ICMR website. Okay. Because the textbook which you have, it will be used for the next few years as well, for the coming of batches as well, because only when the author can make the addition, when the author makes the new addition, the recent changes that ICMR has brought can be captured into the textbook. Okay, so this is the reason why I mentioned always follow the ICMR website for RDA. It keeps on changing, because those who have the old textbook, it is given 40 mg is required for an adult woman, and 60 is required for a 60 mg is required for a pregnant woman. Okay, but now you can see the kind of change ICMR has brought in the recent edition. It is mentioned 65 is for adult women, plus 15 increased by plus 15 increase has to be kept for the pregnant woman. Okay, so you can see the drastic change in the value. So this is the reason why, again, this value, the 65 plus 15, will also change in the future, in the coming 1 year or 2 year. ICMR will update that on their website, but it will not translate in the textbook. So please keep track of these kind of facts, these informations. You have to keep track from the website. Is it clear to all? Knowing the healthy range of RDA is important. Okay, but always you have to be on your toes with these sites so that you stay updated. Even with calcium, calcium was just 1000 mg, then ICMR changed it to 1200 mg. Now they are going back to 1100 mg. So calcium requirement is also changing. So keep a track for calcium requirement as well from the ICMR website. Okay. So all the nutritional requirements, is it clear? Wherever you found the confusion, is it clear which site you have to check now? Is the confusion clear for the nutritional requirement pertaining to RDA? ICMR. You can check ICMR. Along with that, you can check NIN also. I have mentioned in the chat box ICMR or NIN. NIN stands for National Institute of Nutrition in Hyderabad. They also have their website. You can check their website also for the recent updates in nutritional policies, nutrition-based research work done in India pertaining to the Indian population. These two sites which I have mentioned here, these are not for international clients or international population, worldwide population. These two sites cater only to the dietetics and the nutritional requirements of Indian population. Okay. So relationship between maternal health and the maternal and fetal nutrition. So it's a very simple flow chart. If the mothers have inadequate food intake, mothers will go into a state of maternal malnutrition, undernourishment. Okay. And if the mothers are undernourished, okay, they will have reduced blood volume, their cardiac output will be increased. Okay. Reduced blood volume, but the cardiac output is increased. And because of which nutritional supply to the fetus will be decreased. Okay. And even if whatever blood supply the fetus is getting, since the mother is malnourished, it is not adequate for the fetal growth. Okay. So because of reduced nutritional supply to the growing fetus, placental size will be increased. Placental size will be decreasing. And along with that, growth retardation can take place in the growing fetus as well. So this is how inadequate dietary intake or inadequate food intake of the mother can impact the health of the child. For any international standards, you have to follow FAO, Food and Agricultural Organization of USA. They cater usually to the American population, but majority of their studies are published worldwide. Okay, whatever outreach works they do, okay, it is for the benefit of the entire global population as well. So FAO, you can check with FAO. Okay. UNICEF, UNESCO, they also post certain nutritional and food related health based diets. Okay, that information you can get from the UNESCO and UNICEF if pertaining to the well-being of mothers and children. Okay. So coming to the food requirements, all the 5 basic food groups has to be covered during pregnancy. Can anyone answer or can anyone guess what are the 5 basic food groups? 5 basic food groups. Iron, protein, zinc. No, these are not food groups. These are the vitamins and minerals. Okay. Yeah, cereals, pulses, fats, fruits and vegetables. Fruits and vegetables are in one category. Pulses, legumes, cereals in one category. Meat, milk products, and meat in one category. Okay. These are the 5 basic food groups. You just take a plate, you divide your plate into these 5 basic food groups. Okay. In certain pyramid substructure, you will find fat and sugar is in one category, in the topmost category, because you have to use it in very minimum ratio. Okay. So you can check the chat box for the correct answers. These are the 5 basic food groups, because usually when this question is raised, people get confused and they answer like carbohydrates, proteins, okay, fats and lipids, vitamins, minerals. These are not food groups. Okay, these are not food groups. These are macro and micronutrients. Okay, vitamins, minerals, all those carbohydrates, proteins, fats, alcohol. They are macronutrients. Okay, micronutrients are your vitamins, minerals, electrolytes. They all come under the micronutrients. Okay, so when we talk about five basic food groups, okay, when you make your menu plan, when you make menu planning or when you make a diet plan, your diet plan should be based on these five food groups: cereals, pulses, milk, meat, fruits, vegetables, fats, and sugar. Okay. So all the five basic food groups has to be involved, and 3 cups of milk or equivalent. What are the equivalent of milk? If the mother cannot have 3 cups of milk, she is having some morning sickness related to the milk. Okay, she can't have milk. People have different dietary choices when they are pregnant. They have different food intolerances and sensitivities. What is the equivalent of milk? Buttermilk, definitely. Yes. Curd, buttermilk. Any plant-based milk, soya milk, or any plant-based milk. Okay. Plant or millet-based milk, oat milk, almond milk. Okay, these are like, for example, it's not that 3 cups of milk 3 times a day she has to have. She can have a glass of milk in the morning, a glass of milk, buttermilk in the lunch. Okay, or curd, a cup of curd in the lunch, a glass of buttermilk in the evening snack time, or whenever in the midday snack or something like that in between. Okay, and at night also, if she wants to rest properly, she can have a bit of milk as well. Okay, so that is how you can you can break down the milk and milk equivalent throughout the day. Okay, see, plant-based milk, if you buy the packaged plant-based milk, specifically look for fortification. Fortified with vitamin D, vitamin B12, calcium. Specifically, nowadays, whatever plant-based milk you can buy from market, okay, the carton boxes you get from market, you check the box, most of them are fortified by these essential nutrients, because usually the plant-based milks are used by vegetarians and vegans, and the deficiency of vitamin D, calcium, and vitamin B12 is very much prevalent in vegetarians and vegans. Okay, so these plant-based milk naturally come fortified with these nutritional elements. Okay, so you can go for the fortified one. Check, do your research. Do just even if you type plant-based milk in Amazon or something, okay, you will get a lot of option, and they have looking at the package, you know what kind of fortification they have, or just read about the product, you will understand what kind of vitamins or mineral fortification they have done. So specifically for vegans and vegetarians, look for the plant-based milk which is fortified with vitamin D, calcium, and B12. Is it clear? Two servings of meat, fish, poultry, eggs, or any alternative protein source. Okay, what could be the protein source? What could be the vegetarian protein source which you can give? Meat, fish, poultry, eggs comes under the non-vegetarian category. Okay, what is the vegetarian protein source which is equivalent to the to these servings which you can provide for a vegetarian mother? Yeah, soya bean, legumes, definitely, pulses, paneer, any cost efficient one, cost efficient ones. Paneer comes with a cost factor, tofu comes with a cost factor. Something an average middle class Indian family could afford. Sprouts, sprouts. Yeah, sattu is also a good protein source. The best thing is giving them sprouts. Okay, sprouts, or the sprout of moong dal or kabuli chana. Okay, any legume which you can sprout it and give it. It's a really good source of protein. Okay. Dark green and yellow vegetables. Yellow vegetables, why? The vitamin A requirement has to be up. Dark green for the iron and folic acid requirements. And dark green vegetables also have enough and good amount of carotenoids, that is vitamin A substitutes. Generous servings of citrus fruit so that vitamin C requirement is maintained. As per the recent data which you have shared, it is 65 plus 50, that is almost 80 mg of vitamin C should be there on a pregnant woman's plate. So if you go and check out or just Google 80 mg of vitamin C, how much portion size of apple, grapes, or oranges, how much you have to give, you will get the answer. Okay, how many oranges can give this particular grams of vitamin C, or this particular how many apples can give this particular grams of vitamin C is given. Okay. Avocado more than a protein source, what is it known for? Can anyone answer in the chat box? More than its protein content. It is known for its good fats. Okay. It is known to be a substitute for butter. Okay. So it is known for the good fat, but avocado is not known for its protein. It may have protein content in it, but it's not the best source. Okay. When we are giving this 2 servings, when they have mentioned here 2 servings of meat, fish, poultry, eggs, meat, fish, poultry, eggs by default are best sources of protein, but limitation is that it's available only for non-vegetarians. So when you are looking for best source of plant-based protein, you have to go for the best one, not the good one, or not the other alternatives, or not the food items which have some portion of protein. Okay, some portion of protein is not what we are looking out here. We are looking for the best source of protein. Okay, like soybean sprouts. Okay, yeah, all the chilas which you have mentioned, sattus. Okay, these all are really good source of vegetable protein plus plant-based protein. Small and frequent meals should be encouraged because it will keep the metabolic rate also. It will not allow the metabolic rate to come down. Okay, it will keep a healthy metabolic rate. Along with that, small and frequent meals will ensure that the mothers will not suffer from breathing difficulties. Okay, it will be easy to digest. They will have a lot of digestive issues, acidity, breathing difficulty. Okay, so having small frequent meals can just negate all these factors. Weight gain should not be more than 40 gram per week. Okay, this you can focus. You can underline this particular fact. In the textbook, they have mentioned all these facts. You can underline it. Weight gain should not be more than 400 gram per week throughout the pregnancy. Every week, there should be a slight weight gain, but it should not exceed 400 gram weight gain on a weekly basis. Plenty of water. Stay well hydrated. Limit the caffeine to 2 cups. Pregnant women can definitely have coffee. They can definitely have tea. There is no harm in it, but in limitation. Okay, because there has been studies that are done. Too much of caffeine can lead to attention ADHD in the unborn child. But after the child is born, too much of caffeine intake in mothers could lead to a child suffering from ADHD. Okay, the child who is irritable, okay, has a colic or may have colic response. Colic response means cries with a very shrill kind of cry. Okay, very high pitched cry. Okay, so these are associated with high caffeine intake. So please remember the difference. High caffeine intake is the culprit here, not a regular caffeine intake. Okay, having 2 cups, limiting yourself to 2 cups of tea or coffee on a daily basis will not affect your pregnancy negatively. Sugar substitutes should be used in moderation. Do not go for any synthetic sugar substitute. It's better to avoid sugar substitutes in general. Stevia you can use, but don't just completely depend on stevia. You have to use sugar as well, sugar, jaggery, honey, or whatever sweetener you use. You can use that. Along with that, you can add stevia also if you want to limit the calories, but don't completely depend on stevia or don't completely depend on any other sugar substitutes. Okay, because the long-term effect these substitutes may have on pregnancy is not researched well so far. We do not know what kind of impact these sugar substitutes can have, long-term impact the sugar substitutes can have on the pregnant woman's body and the growing child. It's not studied yet. Okay, so it is an area which is under researched. So it's better to practice prevention here. Okay. Is it clear about the food requirements, the guidelines regarding to food requirements? So general dietary problems which women face during pregnancy, first and foremost is nausea and vomiting, morning sickness. Okay. Here to tackle morning sickness, again, small and frequent meals. If your stomach is full of the food, okay, that is the reason why you may suffer from projectile vomiting. It will be very easy for the mother to undergo projectile vomiting. Projectile vomiting means within one go, the entirety of the tummy will be emptied. That is projectile vomiting. Okay, so to avoid that, small and frequent meals is better. And also, would you choose liquid diet here or would you choose dry food here when a mother is suffering from morning sickness? You have to go for dry food. Okay. Even if it is chapati and some sabzi, don't go for gravy based curries. Too much of gravy based curries. Go for dry sabjis and chapati. Okay, and go for chapatis which does not have too much of ghee, fat, or anything on it. Plain chapatis and dry sabzi. Okay, there is a Gujarati food called khakras. Okay, that can be given, and glucose biscuits can be given. If the mother is having severe vomiting, give her glucose biscuits or any crackers. Okay, so that she has the glucose in her, she has the energy in her, and try to look out for which all are the dry food like lemon rices or any food that is not too much tempered but it is dry in nature, and try to avoid giving them too much of gravy or soup kind of food items. That has to be avoided because it is very easy to be vomited out. If it is dry, if it is a dry food, it will stay for a bit in stomach. It will not just be vomited out easily, so that the nutritional status is not impacted. And go for skimmed milk. Don't go for full toned milk when there is nausea and vomiting. Skimmed milk is better tolerated. Fatty foods, fried foods, excessive seasoning has to be avoided. Coffee and any strong flavored vegetables should also be restricted because it will already the GI tract is under trouble. Caffeine and all are irritants. Okay, these are actually stimulants and irritants. So try to limit them or completely avoid them if possible. You can go for alternate beverages like peppermint tea, green tea. Green tea has very less caffeine in it. Green tea, peppermint tea, cinnamon tea, these kind of teas you can indulge in. It is relaxing as well, chamomile teas, etc. So ginger is known to calm down the gastric issues. So 1 gram per day of supplemental ginger can be taken for 4 days to 1 week until and unless you see the symptoms subsiding. You see the frequency of nausea and vomiting subsiding, you can take supplemental ginger. It can calm down the vomiting or any other gastric troubles. And in some cases, if you just stop taking the iron supplements for a while, because iron supplements are also known to give nausea. Okay. If you have iron supplements in empty stomach, if anyone had iron supplements in the empty stomach, you can mention in the chat box what kind of side effects you may have faced. Specifically, having iron supplements in empty stomach. Okay, it's very common to undergo nausea and vomiting. Okay, so if you limit the iron supplements for a week and then take supplemental ginger supplements so that you can reduce the nausea and vomiting, it will be beneficial. Yeah, pain in the stomach pain. Okay. Yeah, stomach pain, nausea, these all are, yeah, belching and constipation. It depends, it's very subjective, but definitely there are side effects associated with taking iron tablets on empty stomach. Okay. Next you have is leg cramps. It is usually because of calcium levels that is reducing, okay, or the calcium, as I have mentioned, 1200 mg of calcium has to be maintained. If such high amount of calcium is not being maintained, there are high chances that the mother can suffer from leg cramps, specifically at night. Okay, at night, it is very common in pregnancy. At night, the mothers may wake up out of their sleep because of contracted leg muscles, usually in the calf area. Okay, it is very painful. She has to wake up, she has to jump, she has to move her legs, etc., massage the legs, etc. Okay, sleep disturbances because of it. Usually it is a sign that the calcium levels are falling down in the mother circulation. Okay, so if you take proper calcium supplements in this point of time, you can do the symptomatic management for leg cramps. Okay, and on top of that, the blood volume is increasing. And because of this increased amount of blood volume, too much of blood in the system, you must have noticed this swelling on the feet. Okay, swelling on the feet, because there is a limit to which the lymphatic vessels can carry out the excessive interstitial fluids to and fro the body. Okay, and that is the reason why leg cramps can come, either because of low calcium levels, and also because of the swelling and the heaviness or too much of blood volume. Okay. And some prevention or relief to this leg cramps have been seen, that if you reduce the milk consumption or any food items which is high in phosphorus or which is too high in calcium, okay, intake and supplementation, so that has shown some relief. But calcium supplements in other form you can take. But if you reduce the milk, if you just take, if you limit your milk, or you can just use only skimmed milk instead of full toned milk, you can see some relief taking place. Yeah. Then heartburn. The best remedy for this is to have less spicy food, and don't have too much of fatty food or deep fried food. And after having food, don't directly go to lie down. Okay, at least for 2 to 3 hours, don't lie down after having any major meals. After, if you are snacking or something, it's fine, but after having some major meals like breakfast, lunch, or dinner, do not immediately go and lie down. Okay, 2 to 3 hours are only after having meal, only then you should lie down, so that can prevent your heartburn. Sitting upright after meals is important. And certain beliefs and avoidances and cravings and aversions. Okay, you can mention certain beliefs which you must have come across, that don't give pregnant women this should be avoided during pregnancy. There is no scientific research or evidence based on this, but whatever you may have come across your entire life, you can mention that in the chat box. Okay, so because every region in India has a separate system of beliefs and avoidances. Okay, what are the local practices in northern India may be completely different from southern India. Yeah, papaya is something that is very common, specifically raw papaya. Raw papaya, it's a common belief that it could lead to abortions. Okay, you can mention in the chat box. Yeah, Ajinomoto is essentially bad for everyone, not just pregnant women. It's Ajinomoto is MSG, which is like bad for general health as well. Okay. Yeah, like based on your regional differences, you must see what kind of food items are according to cultural practices, how they have to be avoided. Okay, like consumption of papaya and saffron. Okay, consumption of saffron is told people believe that it will give you a fair child. Okay, it's colorism basically. So, but there is no evidence behind that. Okay, consuming saffron and having a fair child, consuming papaya and it undergoing certain miscarriages or abortions, there is no, so far there is no scientific evidence on that, but this is what people tend to practice. Okay, then you have cravings and aversions, in the sense of it depends. It's some women may have sweet cravings, some may have salt cravings. Okay, and so some may have junk food cravings, some specific drinks, caffeinated drinks, etc. Okay, it is a very powerful urge that she wants to have that. Otherwise, she may not be in a good mood or something. It is completely hormonal. Usually, it is seen that these cravings are associated with micro deficiencies. Whatever micro deficiencies a mother may be suffering from, okay, it is shown. It is physiologically shown in the form of cravings. Okay, aversions, it is also very subjective. You cannot predict at all which kind of food item you will feel averted to during pregnancy. Then weight gain during pregnancy, this is important. All pregnancies should be started at the body mass index between 20 to 26. A woman should be in the healthy body mass index between 20 to 26 for a pregnancy to take place. And pica is a state in which you crave for things that are not edible in nature. Okay, can you give some example? It's not just common in pregnant women, but even in certain healthy adults, people undergo this pica craving. Okay, for example, you want to drink kerosene, the smell of petrol, you feel like eating it. Okay, wet mud, when you smell the wet mud for the first time, you feel like eating it. Yeah, chalk, mud. Okay, what do you think would be the reason of pica? Is there any evidence of pica and the health of the mother? Any association? Any evidence based association? It is mineral deficiency. Okay, it is mineral deficiency. It's not vitamin deficiency. Some micro mineral deficiency. Okay, any mother who is undergoing some mineral deficiency, micro mineral deficiency, specifically micro mineral, not major minerals, micro mineral deficiencies, they undergo pica cravings. Okay, like yeah, iron, magnesium, zinc, micro minerals, water, selenium, whatever micro minerals, because the mind knows that soil has it. Okay, soil has it, stones has it. So the mind wants to eat soil, eat stone, eat chalk. Okay, so that is pica. So weight gain of pregnancy, the optimal weight gain should be around 11 kg to 13 kg. Okay, when you start your pregnancy and when at the end of the pregnancy, there should be at least 11 to 13 kg of weight gain. That is healthy. Okay, that is about 900 to 1800 gram, that is 1.8 kilogram or almost 2 kilograms. Okay, 1 to 2 kilograms during the first trimester is completely fine. By the end of the third month of pregnancy, you can increase your weight just by 1 kg or 2 kg. Okay, so you can understand how minimum that kind of weight gain is, because it's a natural fluctuation. Okay, pregnant or not, women usually undergo this natural fluctuation very in a very common stance. Okay, yeah, not always, it's not always 12 kg, that the range is 11 to 13 kg. Okay, and thereafter, after the first trimester, second trimester onwards, every week approximately 400 grams of weight gain should be there. And during the remainder of the pregnancy also, 400 grams of weight gain per week can be maintained, not more than that. And sudden sharp increase in the weight after 20th week of pregnancy may indicate that like you may be suffering from edema, because of fat deposition, you will not suffer from sudden weight gain. Water retention can give you sudden weight gain. That's the difference. The weight gain that you have because of fat, because of increased consumption of fat, is very steady. Okay, but suddenly if you're seeing weight gain spiking up and going down, that is because of the water retention issues. Okay, as edema or swelling related issues. So that you have to watch, because it could be a sign that mother is suffering from gestational hypertension. Next, complication of pregnancy. Anemia, specifically iron deficiency anemia or folic acid deficiency anemia, is very common. Okay, and in which hemoglobin levels will also fall if it is below 11.0 grams per deciliter. The hemoglobin level, it is considered as the mother would be anemic. Okay, pregnant woman is anemic if this is the hemoglobin level in her blood test. So anemia is one of the major causes of maternal deaths as well, worldwide, not just in India. Okay, and it is also another major factor of low birth weight babies. Low birth weight babies also have a higher infant mortality rate. Okay. So symptoms of anemia, can you just mention in the chat box symptoms of anemia? Whatever comes to your mind, like when you hear the term anemia. A detailed class by Dr. Madhavi on anemia has been uploaded. I guess few months back she had took this class on anemia. It has been uploaded in the recorded sessions link of the YouTube link of nutrition and dietetics course. You can check that. It is by Dr. Madhavi. Please check that. Okay, she has in detail taken about anemia. Yeah, low energy levels, lethargic, risk of depression, or already they may be depressed. Okay, dizziness, lack of concentration, mood swings. They look very pale. There is no glow in the face. Okay, so yeah, these all are the some normal signs and symptoms which is understood by everyone of anemia. So treatment, how do you treat anemia? The best option is we go to any PHC or any subclinical centers. Free folic acid tablets and iron tablets are given to pregnant women. And also for school children, teenagers and school children from government school, public schools, free folic acid tablets and iron tablets are supplied to them. Okay, so that is the best way in how anemia can be corrected. Also anemia, we will take that in detail. Anemia has different stages. The first stage of anemia, you can definitely correct it with just your diet. You don't have to eat any supplements. Just by making certain modification in your diet, the stage 1 anemia can be corrected. When you progress more to stage 2, stage 3, stage 4, that's when you require more supplementation. In stage 4 and all, blood transfusion is also required to correct anemia. Okay. So prevention through PHCs and through ICDS program, Integrated Child Development Program, with the help of UNICEF, okay, and the World Health Organization. 60 mg of elemental iron and 500 microgram of folic acid tablets is supplied free of cost. Okay, on a daily basis they have to take this, and this nutritional program called National Anemia Prophylaxis Program. Okay, they have charged upon to take on the toll of reducing anemia in pregnant mothers, school children, teenagers as well. Next is constipation. As a physiological change in pregnancy, the peristalsis movement. Peristalsis movement is it's a wave-like movement of your entire GI system. It starts from your mouth, from your esophagus. It ends at your uh, rectum, anus. Okay, so it's a wave-like movement which propels the food forward and forward and forward. Okay, from duodenum from esophagus to stomach to duodenum to ileum to jejunum, ileum, large intestine. Okay, everywhere this one wave is just propelling the food forward and forward. So in pregnancy, what happens? This peristalsis moment slows down because naturally, so that the mother's intestines have enough and more time to absorb as much as nutrients as possible from her food. But what is the other effect of this reduced peristalsis moment is constipation. Okay, and along with this particular physiological change that naturally happens to every pregnant woman, on top of that, if she is on iron tablets, nowadays the iron tablets which you get in this generation does not comes in certain in a specific combination that will not lead to constipation, but majority of a side effect is constipation. It's still constipation. Okay, so physical inactivity also, mothers are tired, lethargic. If she's anemic, again she will be lethargic, no physical activity. That will also lead to constipation. Not having enough fiber rich food can lead to constipation. So natural laxatives like multigrain, okay, or any other natural laxatives, not taking the medical laxatives, but having natural laxatives like multigrain, whole grains, fiber rich food, okay, sweet potatoes. These will alleviate the constipation and also be well hydrated. Okay, some other reason is that not having enough water could also lead to constipation, but staying hydrated, have fiber rich food, and make sure you are physically as active as possible. This can alleviate the symptoms of constipation. Instead of fruit juices, try to have whole fruit along with the outer coating. Okay. Edema. So cardiac, so the stroke volume, the blood stroke volume increases. So edema cannot be, it is not something that we can prevent. It happens, okay? Usually the swelling on the feet and extremities happen. Usually the swelling on the feet and extremities would definitely take place. It is mild edema. Usually mild edema will definitely take place. It's a physiological edema. You cannot you cannot just avoid it. Okay, blood volume increases, blood stroke volume increases. Edema has to happen. Okay, but how can you manage it? Keep your foot in elevation while sleeping and all. Just keep your foot in elevation, and make sure you are well hydrated so that the kidneys are functional enough to take out the urine as much as possible from the body, so it can give some relief to edema. Some sodium restriction and dietary changes can also, if you're suffering from moderate to high edema, just do some sodium restriction, reduce your salt intake. Okay, or any sodium based food. Too much of sodium based food. Don't have too much of baked items, bakery items, because baking soda is used. Sodium bicarbonate will be used in that. So reduce your bakery items and all. So you can see the changes in edema as well. Pregnancy-induced hypertension. So this is a situation in which the pregnant mother is not suffering from BP, high BP or hypertension before pregnancy. Just because of the reason of pregnancy, now she is a hypertensive person. Okay, her BP increases, specifically the systolic BP increases during pregnancy. Okay, so that is pregnancy-induced hypertension, PIH in short. Again, here you can just do the salt restriction, sodium restriction, and give mother well rest. Okay, she should be in a stress-free environment. She should not be taking over stress. Okay, stress-free environment, salt restriction, and moderate and relaxing aerobic activity, not the stressful one, not running, jogging, relaxing like yoga, or any yoga kind of, and brisk walking, not heavy walking, not running. Okay, this kind of activities can be done. Okay, stress-free environment is important for the maintenance of pregnancy-induced hypertension and sodium restriction. And hypertension in general, again, sodium intake has to be restricted. and correction of any dietary deficiencies. See the micro minerals, correct the dietary deficiency. Potassium deficiency, if it is there, some potassium rich diet has to be given so that it can negate the effect of sodium intake as well. And weight management. Okay, pregnancy induced hypertension is usually seen in mothers who are overweight. Okay, even before conceiving, even before getting pregnant, women who are overweight to obese, they usually suffer from PIH. So weight management can also maintain your PIH as well as hypertension issues. Then GD, that is gestational diabetes mellitus. Same like PIH, diabetes was not the condition which was present before pregnancy. This gestational diabetes mellitus is seen only during the time frame of pregnancy. As soon as the child is born, her blood sugar level comes back to normal. Her body can tackle the blood sugar levels, but during pregnancy, her body goes into a stage of diabetes, that is gestational diabetes mellitus. Okay, it is not uncommon. It is very common these days, GD, and it is because of certain lifestyle changes, certain obesity related issues before pregnancy. In these cases, GD chances is higher. It runs in the family as well. If a mother, especially among the first generation females, mother had gestational diabetes mellitus, high chance that her daughters may also have gestational diabetes mellitus. Okay. So again here, insulin antagonism and insulin antagonism means cells are not responding to insulin. Insulin, her body is secreting, her pancreas are secreting insulin, but the cells are not responding. Usually women who had suffered from PCOD, PCOS, thyroid issues, overweight issues before getting pregnant, they are already in the state of insulin resistance. Okay, if your body is in the state of insulin resistance before pregnancy, there are high chances that you may suffer from gestational diabetes mellitus. Okay, so in the conceptual nutrition, you have to correct all these areas so that your pregnancy will not be complicated. So these all come under high risk pregnancy: PIH, GD, eclampsia, preeclampsia. We'll see that as well. Preeclampsia. Here you can see then the image. In preeclampsia, swelling will be there on the lower extremity. Protein will be there, presence of protein in the urine, and hypertension, systolic hypertension. That is when we say BP, okay, normal BP. It's a range, okay, but 120 by 80 mm of Hg is usually considered as a normal BP. So the 120 which you see, that is systolic BP, arterial BP. 80 what you see is diastolic BP. Okay, systolic BP means when the heart is contracting. Okay, when the heart is contracting, the pressure that it has, that is systolic BP. When the heart is relaxing, the pressure it has on the blood vessels, that is diastolic. Okay, so while the heart is in contraction state, that's when the BP, that BP is high, but the diastolic BP is completely normal. So it could be something like 140 by 80, 140 by 80. Okay, an example. It's an example. 140 by 80. 140 is the systolic hypertension, high BP, but 80 diastolic, it's normal. Okay. So these are the three major signs of preeclampsia. In eclampsia, all these three signs will be there. Swelling will be there. Protein in urine will be there. Hypertension is there. Systolic hypertension is there. But what makes it different from preeclampsia is the presence of convulsions. The mother gets seizures, fits, okay, convulsions. So this is where the change takes place. This is where the mother has to be completely bedridden. Even in preeclampsia, mother has to be bedridden. Okay, throughout the pregnancy, mother will be bedridden. Specifically, when it comes to eclampsia, she will be admitted and she will be bedridden. Okay, so what is the main difference between preeclampsia and eclampsia is the presence or the absence of seizures, convulsions. Okay, the rest everything is the same. Weight gain because of edema, the entire body will be in the state of edema, but weight gain will be there. Hypertension, protein in urea, okay, and seizures when the mother goes into a state of convulsions. That is what eclampsia. It is completely, you cannot do much of dietary management here. The only dietary management is sodium restriction, weight management. Okay, but apart from that, everything is medical management. It will be treated as a clinical case. Okay, eclampsia, preeclampsia, gestational diabetes mellitus, PIH, these all are treated as a clinical case. Okay. These are the exercises which you can safely follow during pregnancy. For most women, pregnancy exercise is not only safe, but it is also beneficial for their babies and their own health during pregnancy and after birth. We focus more on aerobic exercises. Okay, aerobic exercises, mild to moderate aerobic exercises is best for pregnant women. Okay, safety for healthy women who do not have any complications. But these things you cannot advise for high risk pregnancies. Okay, these exercises is only for a healthy pregnancy. It is not for high risk pregnancies. Okay, exercising is safe, but it should not lead to any complications. Okay, but doctor's clearance is a must, because the gynecologist will identify, is this pregnancy a high risk pregnancy or not, and based on the future complications or expected complications, list of exercise is given by the gynecologist. Okay, so in a general way speaking, best pregnancy exercises are brisk walking, Kegel exercise. Kegel exercise also are taught by the gynecologist. Kegel exercise is supposed to strengthen your pelvic muscles, the pelvic regions, because it will be helpful for labor. Okay, swimming, stationary bicycling, prenatal yoga, jogging, dancing. Okay, these are best exercises. Things that you have to avoid is all contact sports. If it's a athlete or a woman who indulges in contact sports, it has to be avoided during pregnancy. Basketball, soccer, yoga. Hot yoga means you are in a closed chamber. There is no air condition. Okay, and in that hot, in the humid chamber, yoga is practiced, and it's not a relaxing kind of yoga. It's a cardio kind of yoga. That is hot yoga. Okay, it can increase your blood pressure a lot. Skiing, horseback riding, ice hockey, boxing, these things has to be avoided. So it can ease your labor. It can reduce the risk associated with vaginal delivery. Okay, it can reduce the chance of C-section deliveries as well, and it prepares the body for labor. That's the main benefit of practicing these exercises on a regular basis. So Indian pregnant women, according to ICDS stands for Integrated Child Development Scheme. Antenatal care. So Government of India, along with the World Bank and ICDS, ICDS is the one who is sponsoring Government of India with the help of World Bank to take care of the antenatal requirements of the mothers. Okay, and like free monitoring of their weight, free antenatal care from the PHCs, community health centers, primary health centers. Okay, these all come under the antenatal care, given free of the cost, giving free medications, supplementations, nutritional supplementations to mother as well. They all come under the antenatal care. Immunization, universal immunization, that is also free of cost. TT immunization is given to mothers. Folic acid supplementation, food supplementation, okay, nutritional health education, and referral of all the high-risk cases to obstetrician or a gynecologist. Okay, these all come under antenatal care. Then weight monitoring. Again, this can be done in the sub centers or PHCs, or on a monthly basis. Weight monitoring can be done, or whoever is the obstetrician the mother is visiting, they can also do the weight monitoring. TT immunization, iron and folic acid supplementation, health education, food supplementation for selected criteria. Nutritional education is also a major part these days they have developed, and referral for at-risk or high-risk cases to obstetricians and emergencies. Mother and Child Protection Card. There is if you have the textbook, an example of Mother and Child Protection Card is given. That is from the time the mother is under antenatal and antenatal care, intranatal care, postnatal care, and after that the child's health care. Okay, child's milestones, growth and developmental milestone, everything is recorded. That entire process is recorded in this particular Mother and Child Protection Card. So you just, by looking at this card, you can see how the mother's pregnancy was, what kind of deficiencies, complications she had during pregnancy, and how it is impacting the child right now. Okay, the entire record will be documented in this particular Mother and Child Protection Card. It is also given free of cost from every cases which is checked under PHCs. Every pregnancy cases checked under PHCs, they all get the Mother and Child Protection Card, which she has to bring during her follow-up visits. Then Pradhan Mantri Matru Vandana Yojana, so in which monetary benefits are given. In the old textbook, they have mentioned it is 6,000 rupees. If there is any changes in the new textbook, you can mention in the chat box, please. So yeah, for the first child, for delivery of the first child, for safe delivery, 6,000 rupees monetary help is given through the Pradhan Mantri Matru Vandana Yojana to all pregnant women. And it is given in the government hospitals, private, not in private hospitals, but in all the government hospitals. This cost is taken care of. So that's about the class.